Thank you, doctors. Can I request all of you to have your camera on so that I can see you? I'm sure you can all see me, so it will give me a pleasure of seeing you all. Thank you so much. Thank you. Some more people? Come in, please. Thank you. Thank you, Dr. Deha. Thank you, Dr. Nishikanda, Dr. Yashika. Some more, some more. We can accommodate 25 people in this screen, so we can have some more people. Thank you. All females. How come? So women power? Where are men? Missing? I request everyone to have their camera on, at least if you're comfortable and if you think you can. That will give me a visual field of you being present and connected with me. Thank you so much. Thank you, Dr. Rupesh. Thank you. So I believe you all know about the program that we are going to discuss today. Any idea? What is the issue that we are going to discuss? No idea? Nobody has any idea? So after all, you're investing such an important, time of your, a day. So no idea what we are going to discuss? Nobody has any clue?
So we had sent out the message that we are going to do a communication excellence workshop.
OPD communication, yes.
So you have an idea that it's a communication.
It's OPD communication, yeah.
Yes. Thank you. Thank you. So if I ask all of you, any idea what percentage of your personal and professional effectiveness and success comes from your communication and interpersonal skills? Any idea? You can write in the chat box, you can unmute and speak. And it's perfectly all right if the percentage is rightly said or not rightly said, but make an attempt. What percentage of your personal and professional success and effectiveness comes from your communication and interpersonal skills?
I think in medical field, everything is about communication. If we try to convince the patient or anything, if we want to suggest patient, explain patient, everything is about communication. How confident you are, you can guide patient well, patient can build a trust on you. So everything is about communication, I guess.
Absolutely, absolutely. I think you're spot on. And it's not just about your communication with the patient or their family members. I think it's our communication with everybody and anybody, either at the professional front or in our personal life also. So some of us who are very effective in our communication, we develop wonderful, relationship at home with our family members, with our spouses, with our kids, with our parents, and with our neighbors also. And a lot of us have challenge in connecting with even our neighbors or with our patients or anybody and everybody. A study by Harvard says 85% of your personal and professional success comes from your communication and interpersonal skills. Can you believe this? Can you believe this at 85%? So even if you are an average clinician, but if you have good communication and interpersonal skills, you must have seen a lot of private practitioners having a roaring practice just because they're able to connect with the patient, talk to the family properly, understand their concern, talk to them, and they're able to, engage the patient and ultimately prepare the patient for surgery or procedure or for treatment and follow-up. That's the importance of communication skills. Unfortunately, these skills are not inculcated in the right manner, in the right quantum at the medical school level. I'm sure you'll agree with me. I don't think any one of you had a formal training in communication. So whatever communication skills you are practicing right now, they're majorly what you know, what you understand, or what your own personal communication style is. So as a result, your individual success actually is dependent more on your own personal communication skills. Of course, fortunately now, medical colleges are investing a lot of time in inculcating communication skills. I don't know if you know or not, 2019, they have introduced ATCOM module, that is Aptitude, Ethics, and Communication module, and they are teaching communication. But right now, people who are already in practice, they really need to get to learn the knack of communicating. You may be an excellent clinician, but if you're not able to create a dialogue with your patient, you may not actually have your patient on your side. Especially in today's era, when patients go window shopping, they'll only get convinced with the doctor who is able to build connection, answer their questions, explain them, or address their concern, and the patient is all yours. All yours. So this is the background of the program that we have designed. These sessions are very practical. I'm not here to talk any theory, and I believe in the philosophy of Socrates, who says, "I cannot teach anybody anything, but I can make you think." So I honestly believe in the same philosophy, that I can't teach anybody anything, because you already are learned people, educated people, professionals in practice for years together. I have each one of yours profile, so I have a fair idea about your background. So I'm not here to teach anything. But definitely through our discussion, through our participation, we are going to get something really concrete and meaningful, which is not only going to help you while you're working with Pristyn, but I think as professionals, ultimately all these skills you are going to use in your professional arenas wherever you will go, and also in your personal life. So only one thing that I want from all of you, only one thing, and that is participation. That is participation. Keep your camera on so that I'm connected with you and you are connected with me. What happens when you put off your camera and you're not looking at me and I'm not looking at you? We get disconnected. So just for this much time, for 1.5 hours, if you can just sit at one place, have your camera on, so that you can participate, you can ask questions, you can, if you have any doubt or any clarification, or you don't agree with me, you can put up that question. So can I request everyone once again to have your cameras on? Thank you. Thank you once again. And if it is possible, please keep your cameras on, because that will keep you connected with me. So to start with, I'm going to show you 2 videos. So these 2 videos have been done by 2 doctors, Indian doctors, because usually we get to see the doctor-patient consultation usually from the Western world, and we honestly do not relate well with them, because the kind of interaction they have, that's not practically, the kind of communication or interaction you have with your patients here. So these videos have been done by Indian doctors who are very passionate about teaching communication to doctors and healthcare professionals. So watch these videos, and 3 things that I want you to observe in the video are, okay. So can I request all of you to keep your device on the mute mode, and when you're answering, please unmute, and then you can put it back to the mute mode. So I'm going to show you 2 videos. They're just 2 to 3 minutes videos. 3 things that I want you to observe in the video is, what are the good points that you observe. So I would request each one of you to have a copy and a pen with you, because there will be activities, there will be fun activities, and you will require a copy and a pen. So you can take a few seconds, pick a copy and a pen, and keep it ready with you. Observe what is good in that video. And also please observe what is not good, what you think was not right. And then something that you think is non-negotiable, I would request you to observe that also. So let me share the screen with you and show the first video. Can I request everyone to keep your device on the mute mode, please? Dr. Suprita, can you please mute your device, please? Thank you. Thank you so much. Yeah. Just 1 second. Let me. So I hope my screen is visible to all of you.
Yes, Dr. Indu.
Please respond.
Yes, ma'am. It's visible.
Thank you so much. Thank you. Thank you.
Next. What? Doctor, my leg is swollen and painful. Since when? For the last 5-6 days. Mhm. What were you doing? Why did you wait so long? This looks pretty bad. Doctor, I thought the pain was just a strain in the leg. Anyway, what do you think now? You could have waited for some more time and we could have amputated your leg. Leave it. What's your sugar level? It is under control, doctor. The fasting was 140. When was it done? What was your HbA1c? It was 4-5 months ago. Actually, HbA1c is an expensive test and I was feeling all right. I can't understand. You do investigation according to your will. You don't take proper treatment. You don't follow our advice. I don't know why you need doctors and you come up with all sorts of complications like this. And what did you do with your leg? I went on a pilgrimage to Sabrimala, so had to walk barefoot. I might have injured, I think. Barefoot? Hello? Yeah. Who? The patient Ram, HIV positive patient. So he doesn't want CT scan. So tell him if he wants treatment, he needs to undergo CT scan. Like, what does he think of himself, yeah? Prime Minister or President? See, discharge him against medical advice and tell him not to come to this hospital once again. Okay? Yeah, bye. And you got this boon. I'll tell you, if you go once again, you will also go near the God. Didn't I tell you about the foot care when you came last time? Huh? And your smoking is continuing without interruption, I guess. I have reduced a lot, doctor. I am smoking only 1 or 2 cigarettes a day now. Can't understand your attitude here. You do smoking, you are overweight, you don't take medications, you don't do investigations. I don't know what to tell you. I'm trying, doctor. And if you don't want to see me, I could consult someone else. See, whatever I'm telling is for your good. I don't know how to tell. I gave you information leaflets last time and you're not following my advice. And if you don't want to see me, it's fine with me. I have got enough work to do. I've got enough patients to see. Sister, please call the next patient.
How was it?
Very negative.
So if I may ask you, what was good in the video?
Good. Actually, everything was bad only. He did not greeted the patient. He was not looking into patient's eyes, and he was busy with his own work. Then he was busy on he interrupted with a phone call, and he was negatively all using all the words were negative of him.
Absolutely, absolutely. I completely agree.
Exactly.
So if I may request everyone to write in the chat box what you think was not right, what you think was inappropriate. Please write in the chat box whatever you observed in the video, what you think was inappropriate or was not okay.
Dr. Aneja.
Yes.
Yeah.
Yes.
Actually, he was not in eye contact with the patient. first of all.
Absolutely. Absolutely. Very
He was
spot
not
on
in,
observation that he did
yeah,
not
yeah.
make eye contact.
He was not
Yeah,
in the patient's eye contact.
absolutely.
Next thing is, he was busy in his phone.
Mm.
Second point.
Mhm.
That should be avoided. Third thing is, he was absolutely rude.
Yes,
And fourth thing is, he didn't listen to the complaint of the patient. Fourth thing.
absolutely. Mhm. Very precise observation.
Yeah, yeah.
I can also see a lot of comments coming in the chat box. Thank you. I think wonderful. So Saloni says talking on phone while talking to the patient, revealing
Exactly.
patient's disease in front of the other patient. Absolutely. I think this is something that is non-negotiable. I think patient's confidential information, we don't have any right to share with anybody or talk about it in public. A lot of time we do this mistake unknowingly or carelessly. When we are in corridor or when we are in escalator, we talk about another patient, or in the presence of one patient, we talk about another patient like this doctor was doing. Very right. Dr. Neha says patient was not greeted by name. Yes, he was not greeted by name. He did not introduce himself. I would even pardon this for the reason maybe this patient has come for follow up. So they already know each other. If you don't take introduction or you don't give introduction, it's still understandable if it's your follow up case. So definitely you will not introduce every time. But then at least that greeting, like Dr. Devidatta said that he did not make eye contact. The patient entered the room. He did not acknowledge his presence. He did not even make eye contact. What about offering seat? Did he offer seat? Did you
No.
observe that he did not? He did
Yeah.
not offer seat, and the way he offered actually very disrespectful. Although I know you wouldn't be doing something like this, but asking like this, that means with eyes he was saying, signaling that sit down, rather than showing where to sit. And then of course, Dr. Neha says he was not considerate about the financial condition of the patient. Absolutely, if the patient says I could not get the HB1C done because it's expensive, maybe for us 300, 500,000 rupees is just peanuts, but for the same patient it could be almost a day's income, and he or she may not be in position to afford it. And of course, no rapport was built with the patient and did not try to win confidence of the patient. Very right. Any other comment from anybody? If you like to write in the chat box or maybe unmute and speak, even that's perfectly all right. Anything else that you observed that you think was not appropriate? There's one more thing that I think I observed in this video. If anybody had the same observation, he actually made mockery of patients' religious beliefs. When the patient said that I had gone to Sabrimala, and we know that when people go to this for this pilgrimage, they don't wear footwear; they go just with the black, wrap around. And I mean, although we know for a diabetic patient, walking barefooted is absolutely not okay. But at the same time, if a patient has done something like this, I can't make fun of the patient, or I cannot laugh on the patient's religious belief. Yes, Dr. Supriya, I think you're right. He did not greet the patient. His body language was not proper. I think that's a very precise observation again. So can you tell me specifically in body language, what you think was not appropriate? Although I agree with you, but I just want to go deeper into your understanding. If you may just share your thoughts. You said his body language is not proper, and I agree with you. So what exactly in terms of body language you observe? Dr. Supriya, I think your camera is not on and I'm not able to hear you.
Was not used on the edge of. Hello. Can you hear me, ma'am?
No, I could not hear you because there was some network issue, I think. Yeah.
Hello. Yeah, can you hear me, ma'am?
We could not hear you. Sorry. So, Dr. Supriya, I think I understand your concept, and I'll just try to, rephrase and tell in my words. See, if he's talking about body language, if you saw the patient's facial expressions, if you saw the stiffness of neck, if you saw the authoritative body language that the doctor had, that kind of intimidated the patient. It gave a feeling to the patient that you are nothing in front of me. So imagine sometimes unknowingly we display this body language and we don't realize that this can impact patient psyche and patient will not feel comfortable with us. I think very, very precise observation by Dr. Supriya. And then, of course, he did not listen to the patient and there was lack of empathy. I completely agree. Dr. Soloni says he was moving on his seat, not sitting straight with proper posture and no hand movement and no eye contact. Absolutely. Again, now you're giving me very precise observations, which is very, very good. So I think if I may ask you, since you have seen this video, can you reflect on your communication with the patient and give me one point that you think you do unknowingly
Dr. Indu, we can't hear you.
Dr. Indu has some network issues. She's just relogging.
there's an electricity failure at my end, but I think this cannot stop us. I'm going to be with all of you in this with this same energy power. So, am I audible and visible to all of you?
Yes.
Thank you so much. Thank you. So if I may ask all of you one question, which is very personal, that will help us in, help you to understand yourself better. Can you think of one behavior that you think to do with the patient unknowingly, but now after seeing this video, you have a realization that this behavior is inappropriate? Can you write in the chat box? I know I'm asking you to go into yourself, look into your behavior, write in the chat box. It will be a great help for each one of us to, to come out with the feeling that, okay, this is what I do and this is what I'm not supposed to be doing. Do you think you are comfortable if I ask you to write in the chat box? Just one behavior. It could be not making optimum eye contact, or it could be your facial expression. It could be that I don't greet all my patients. Anything, any one thing that you think that you would now like to change in your behavior. Please come out with that in your chat box. I'm waiting to hear from all of you. So there are 21 participants and I expect 21 answers. So that will give us an idea the kind of behaviors we do unknowingly, but that can, thank you, Dr. Neha, I think, to have taken the lead. Sometimes I do take my calls, but I do ask for permission qualification before taking them. I think then you are doing a wonderful job. I know we would never take any personal call when we are with the patient. We will only take a call that is urgent and very professional. And thankfully, you are saying that you always, if not take permission, even if you say, I'm sorry, I need to take this call. Even saying this much kind of gives them a feeling that, oh, you recognize their presence and you acknowledge that you are supposed to be using this small basic courtesy in telling that I need to take this call. Is it okay if I take it? But thank you, Dr. I think you took a good thing. What about others? It could be as simple as not making optimum eye contact, or maybe tone of voice. You are not very mindful of your tone of voice. Or maybe when the patient talks about his condition and you think the patient is talking irrelevant thing and I snub the. So I'm waiting to hear from all of you. My chat box is open. So I want to see what do you say? Yes, wonderful. Sometimes yes, I think that's another thing we do very often. Any idea? What do studies say? How quickly we interrupt the patient when the patient is speaking? Any idea? Any guess? Studies suggest we interrupt the patient within 13 seconds of when they start narrating their problem. 13 seconds. Because we think what patient is saying, that's not what I want to hear. Come to the point. They tell me what exactly you are here for. And when we interrupt them, they lose the flow. They forget what they wanted to talk. And that sometimes, also gives them a feeling I could not talk about my problem. I could not tell about my condition. But wonderful. I think a lot of you are giving me good answers. Then Dr. Mittal says need to give appropriate time and proper eye contact with the patient. Yes, I completely agree. And then Dr. Saloni says sometimes I need to scold patient for avoiding disease and not following treatment, only to make him understand the severity of it. Dr. Saloni, I really thank you for admitting this. I know your intentions of being rude with the patient are very genuine, very pious, because you want to really help the patient. But the thing is, sometimes patient will not get to see your intention. And they may take it on face value that you are being rude and you have snubbed and you have insulted. Especially if it's an elderly patient and this person has come with his son or grandson, granddaughter. And in their presence, if you shout at your patient, more than the patient, the attendant is going to feel, dissatisfied or unhappy about the behavior. So I completely agree that when patients don't follow treatment, they don't come for treatment, they don't take their medicines properly, they don't do any lifestyle changes, it's very upsetting because you have done your job in terms of your procedure or treatment or surgery, and then at the end the patient hasn't followed up the instructions, and then you don't see the result that you want to see. So there it's time to learn to talk whatever you want to say in a very assertive manner. Of course, we are going to have wonderful discussion about it, and this is one of the situations I have kept in mind to talk about when things like this happen. What is the right way of handling that? We'll talk about it. But thank you for admitting this. So I'm not shouting, but I have seen most patients. Okay, so they may take it positive because they don't see your shouting in isolation. If overall behavior is good, they will be thankful to you for being so caring that you take the authority of shouting at them. I understand your intention, but at times it can misfire. It can go wrong, and the patient might take it as an insult or humiliation. So we really got to Now, for example, even in this video, he was shouting at the patient that you are diabetic and you're not taking your medicines, you're not stopping your smoking, you're not following up my instructions. And you want to, you will really have to undergo foot amputation. So his intentions were very fair, but the way he was talking, I don't think that made that kind of an impact that we were expecting to see. Now let's watch this second video. Could he have communicated in this manner? Let me show you the video. Just 1 second. Because of electricity failure, I think everything got out of hands. Let me see. This is where we are. Okay, no problem. Let me quickly take it once up. I think that window got closed. Actually, electricity failure was something absolutely unexpected because we'd never have this kind of a situation, but then that's life. I'm using my phone's hotspot, so that's taking longer to. I want to show you the, yeah, this is the video I want to show.
Next. Hello, Mr. Kannan. How are you? Please take your seat.
Thank you.
What can I do for you?
Doctor, I think I have a problem with my leg.
What happened?
4 or 5 days back, I went to Sabrimala and I had to walk barefoot for some distance. I'm very scared now because my leg is swollen and painful in the last 4 or 5 days. And I think I did a stupid thing by walking barefoot.
Let's see what we can do. Good that you realize the importance of foot care. Meanwhile, how are your sugars?
Actually, my fasting sugars was 140, but it was some months ago. I was feeling all right and I didn't do the HbA1c. It is so expensive, you know.
It is expensive indeed, but it is so important to get the investigations prescribed by the doctors because otherwise it's very difficult to give the treatment, you know, and treatment may not work as well. Anyway, can I examine your leg?
Yeah, sure. Sorry, sir. It was my mistake. I didn't do the test.
Hello? Yeah? Yeah. Excuse me for a moment. Yeah. What's the name of the patient? So he doesn't want the CT scan, right? Yeah. Try to explain to him the importance of CT scan. Yeah, when I come for rounds, I will also tell him. Okay. Thanks for informing. Thanks. Bye. Sorry about that. You got infection in your leg. So how are we doing regarding the quitting the smoking?
Regarding smoking, it's doing good. Actually, I brought it down to only 1 or 2 cigarettes per day now, doctor.
Oh, that's good. But total quitting is very important. See, if you have reduced from one pack to 1 or 2 cigarettes per day, quitting that is also not very difficult, And how are we doing regarding the exercise?
Yeah, going on, but I must admit, not so regular.
See, exercise and diet are as important as your medicines, if not more. But for the time being, you need admission for sugar control and control of this infection. Is it okay with you?
Whatever you say, doctor, you have to cure me this time, and hereafter I will definitely take care of myself. This will not happen again.
Yeah, we need to control your sugars and control the infection. Otherwise, it may go for gangrene and may lead to further complications. Now, the sister will go through the procedure and admission process. Okay. And meanwhile, you have this leaflet and you can go through it, which will help you to follow the regimes. Okay. Thank you very much.
Thank you so much, doctor. It was so kind of you.
Thank you.
So I hope this video gives us some idea that the whole conversation could have taken this way. And ultimately, at the end of the conversation, it's not just the patient who should go satisfied. Our satisfaction is equally important, because with every interaction, either we drain some energy or we get some energy. So it's very important that every interaction, every consultation should end up into win-win situation where patient is happy and we are also happy and we enjoy that interaction. So ultimately, the end game is about energy exchange, the kind of energy we exchange with the patient and the energy we receive from the patient. So if I may ask you another question, what do you think? What percentage of communication is verbal and what percentage is non-verbal communication? We all know that we do have non-verbal communication. When you are looking at the screen and not giving me any response, even that's a communication you're making with me. And that's non-verbal communication. When you're looking at the screen and not nodding or not smiling, not acknowledging, that's also a communication you're making with me. A lot of time we interact like this with our patients. So you can well imagine what must be the impact of your communication with them. So I ask my question once again, what percentage of our communication is verbal and non-verbal? Make a guess, even if it is wrong, it's perfectly all right. Okay, wonderful. So Dr. Sakshi says 5% is verbal and 90% is non-verbal. So what about the rest 5% for Sakshi? What do others say? Take a chance. It's okay.
Yeah.
Yes, please. Go ahead.
I think verbal communication should be 60%, non-verbal should be 40%. To listen the patient quietly and patiently. Then we explain about the disease and prognosis and diagnosis. That is the verbal communication.
Wow.
So the basic intent is to listen the patient carefully.
Yeah.
Suppose we are doing a 10 minutes of conversation with a video conversation.
Okay.
So we should listen 40% of the patient conversation. We should listen carefully.
Thank you.
Then we should explain about the disease and the outcomes and the prognosis of the disease and all that, and regarding the procedures.
So, Dr. Devidatta, if I'm not talking about the communication with the patient alone, in general, I was asking that what percentage of communication happens verbally and non-verbally? Studies suggest only 7% of communication happens verbally. 93% of the communication is non-verbal. And in that non-verbal, there are two parts. One is your paralanguage. That means the way you communicate, which includes your tone of voice, your volume, speed of speaking, and voice modulation. That's all part of paralanguage. 55% of the communication is body language.
93%?
Yes.
Sorry.
93% of the communication is non-verbal. So when you all are not having your camera on, that's also a communication you're making with me. When you are not, nodding or acknowledging or smiling or responding, I repeat, that's also a communication you are making with me. When you communicate with your patients and when you are unhappy or you are irritated or you are annoyed with the patient, you would normally not use a lot of words to tell that I'm unhappy with you, but it's visible right on your facial expression and in your body language. But words have power. Even words have a lot of power. We can't deny that words also has an impact. Let's do a small activity. I need 5 volunteers. So I can see only 4 of you with your camera on. So maybe I will be the 5th one with you. Can somebody else also have their camera on if it's comfortable?
I have camera on. I am mine.
Yes, I'm glad that you have your camera on. Thank you so much, Dr. Devidatta. Dr. Supriya, is it possible for you to have your camera on? But I think we have some network issue. Yeah, Dr. Vidya has her camera on. Thank you. Thank you, Dr. Vidya. So, Dr. Vidya, we are going to do a small activity, interesting activity. Are you with us, Dr. Vidya? I'm not able to see you. Oh, thank you. Thank you. So the activity is, imagine that we all are going for a picnic. All of us are going for a picnic. Who all? Dr. Sudhagar, Dr. Devidatta, Dr. Vidya, Dr. Rahul, Dr. Neha, and Dr. Saloni. We all are going for a picnic. And we are having a discussion about, plan, how we are planning. And every time we start the discussion should start with these 2 words. That will be, I'm okay with the plan for picnic, but, and then I say something. So I will start it so that you have an idea how we have to do it. So everybody will have to put something different after the but, because everybody will have a different reason for that but. No? So I would say, I'm okay with the plan, for picnic, but I have an urgent work on Sunday. So I may not be able to make it. So I pass the baton to Dr. Sudhagar. So what do you say, Dr. Sudhagar? Unmute your device, please. Dr. Sudhagar, please unmute your device.
Yeah. I didn't get your question, ma'am. Can you repeat?
So we are discussing about our plan of going for a picnic. We are all going for a picnic. All 6 of us are going for a picnic and we are discussing. So I started the discussion. For example, let's say Dr. Devidatta proposed, okay, let's this Sunday go for a meeting, for a picnic. And I start with answering and I say, yes, I'm okay with the plan of picnic, but this Sunday I already have a commitment and I will not be able to make it. So you have to give your reason by saying, yes, I'm okay with the plan of going for a picnic, but, so after but you have to give your own reason. So please try. Yes, Dr. Sudhagar. Yeah.
I'm okay with the plan of the picnic, but just recently I've gone for a visit. So I will not be available this Sunday. I'll definitely join next time.
Wonderful. Thank you, Dr. Sudhagar. So Dr. Neha, what do you say?
I am okay with the plan of the picnic, but it might rain on Sunday.
That's a very valid reason. What do you say, Dr. Devidatta?
I would say rather, I'm okay with the plan for Sunday, but because I am not available, I'll make someone available for the picnic to do my job.
Thank you. What do you say, Dr. Vidya?
I'm okay with the picnic plan, but I think I have certain surgeries which are planned for Sunday. So I may not be able to make it up.
I completely understand. So what do you say, Dr. Rahul? Please unmute your device.
I'm okay with the plan of the picnic, but just if we could change the place of picnic, that will be better.
But I'm not okay with the place of picnic. Okay, thank you. Okay. Thank you. Okay, so what do Dr. Saloni says?
I'm okay with the plan of picnic, but this Sunday I want to spend some time with my family, particularly my son.
So you will not be able to make it. Thank you. So the next round of discussion that we will have, we will change the word but with and. So instead of using word but, we will use and. So I will make the beginning so that everybody knows, and we'll go in the same order. We'll go in the same order. I'm okay with the plan of going for a picnic, and I'll get food for everyone. Yes, Dr. Sudhagar, it's your turn. Unmute your device. Yeah.
I'm okay with the plan for this week, and from my side, I'll arrange the transport facility.
Wow. We are back with the electricity.
I am okay with the plan of the picnic, and I will drive the car.
Wow. Thank you so much. So we don't have to worry about the transportation. Thank you. Thank you. Well, who is next? Who is next? Who is after Dr. Neha? Anybody? Dr. Devi Datta, please go ahead. Yeah.
Yeah. I mean, Dr. Samira, please for Bronco. Hello.
Yeah, please come again. I could not hear you.
I mean, the wood for bonfire for picnic.
So you say I'm okay about the picnic, and what will you do to make this picnic success?
I mean, woods, lakdi.
Oh, you will get wood. You will get wood for the. Oh, thank you. So we will not have.
I want to do it. I will cut in my work and I will join the bonfire and join the wood for bonfire.
Okay. Thank you so much.
The same day.
Thank
same
you.
Day I will join the bonfire.
Thank you. Wonderful. So what do you say, Dr. Vidya?
I'm okay with the picnic, and I would like to get certain entertainment things for us to play.
Oh, very good. You have some games to play?
Yeah.
Oh, wonderful. Thank you so much. Thank you. So, Dr. Rahul, what do you say?
I'm okay with the plan, and we will take football or volleyball to play at the place. Hello.
Just 1 second. Okay. Yeah, I'm so sorry. Could you please repeat?
I am okay with the plan of the picnic, and I will take football if it is a beach.
Wonderful. Thank you. So you will bring some sports activities. Excellent. Excellent. So what do Dr. Saloni says?
I'm okay with the plan of picnic, and I'll get some something to sit on, like chattai or something. And if it is a beach, then we can get an umbrella or something like that.
Wow. Wow. So what happened? What happened? What was the difference, or what is the difference that you observed in the two interactions, the quality of interaction? No difference? No difference? We will really, have an interactive session when I get some answers from you. Any program can be successful when each one of us contribute and participate. If I'm speaking and you're not speaking, then it will be a one-way communication, that I will be literally pushing you. On the contrary, if you participate, it's your learning opportunity. So choice is yours. If you have something to say, please speak up, participate, give your answer. It may be right, it may be wrong, that doesn't make a difference. But then if you will speak, it will become an interactive session. Programs can only be successful when people interact. So if your patient comes to you and sits in front of you and don't say anything, and when you ask them, what is your problem? And they say, I have no idea, or they don't give any expression, how would you feel? So similarly, in a program, I expect you to, whatever you know, whatever you understand, you need to come out of that. So I want to ask you, what difference did you see in the in both the interactions? Yeah, I can see Supriya has answered. She says second one was more positive and constructive. Absolutely, I think that's a true observation. In the first one, we were using the word but. You could see the negative energy created because of that word. And the moment we replaced with the word and, the whole direction changed completely. A lot of time we use similar words in our communication with our team members, with our juniors, with our staff, with patients, with their family members. Can you think of some words that you use often and you think they are not very constructive, they are not very helpful? Write in the chat box. Cannot think of anything? What can I do? That's not my job. You are responsible for this. Do we say this often? Dr. Devi Datta, please unmute your device. Please unmute your device.
Yeah. First session was very primitive, but it was wonderful. And this session is absolutely excellent. We enjoyed talking with you and all that. we interacted with you. The 2 programs you created, that was beautiful. Okay. And the 2 words you asked just now. Just 2 words. I love you and sorry.
That's a good word. I would say these are 2 good words, but I was asking you any words that you think you use in your communication often and you think they are not helpful or they are not constructive or beneficial.
Okay. Regarding the patient management.
Patient or with your team members, with your staff, it could be anybody, because ultimately all communications are communications.
Okay, okay, ma'am.
So I'm just trying to see if you can think of anything. See, ultimately, this is going to help you to identify the weaknesses of your communication and rectify them. It could be even with your family, with your spouse, with your children, with your parents, or with anybody and everybody. Keep quiet. Shut up. You're an idiot. I mean, we use this often with some of our family members, with our kids. How can you talk like this? So we don't realize that this is actually very, very damaging to the relationship. So can you think of any words or any statements that you often make, and now you can reflect that, yes, it can be very damaging to my relationship with my family or with my patients or with my staff?
Ma'am, sometimes when the BDs give us leads, so sometimes they make a diagnosis for us. Sometimes we do say to Dr. Mat banna. You don't be a doctor. No, this patient is for ma'am DNS septoplasty.
Exactly.
You don't be a doctor.
Wonderful. I really appreciate Dr. Neha, and you have actually picked up a real, kind of comment we often make. Patients, when they ask a lot of questions, we say, "Bhaiya, tum ilaj karane aaye ho ki meri knowledge check karne aaye ho?" I've seen this doctors saying, है ना, like आपने कहा कि आपके उसमें दीदी ने आपको कुछ बोला कि डॉक्टर साहब ये पेशेंट इस केस का है, पेशेंट्स कई बार आकर कहते हैं कि डॉक्टर साहब मुझे डिप्रेशन है, डॉक्टर साहब मुझे मुझे ये तकलीफ है, मेरी किडनी में स्टोन है, तो एंड यू फील कि ये इंस्टेड ऑफ टेलिंग व्हाट इज योर प्रॉब्लम व्हाई आर यू गिविंग मी द डायग्नोसिस, और जैसे आपने कहा कि हम एकदम से गुस्से में बोल पड़ते हैं कि भैया डॉक्टर मत बनो, अपनी नॉलेज मत झाड़ो, एंड सी आई मीन मे बी दैट पर्सन इज नॉट doing it with the idea to insult or to point out that I know more. Maybe whatever the understanding the person has, they try to talk about it. But then when you say like this, what do you think is the impact on the other person?
Sometimes they might feel insulted, even though my intention was not that. But sometimes they feel that the doctor was rude, and then you don't have a good rapport with the same BD.
It is not sometimes, it is always.
It's always.
It is always. It is always. Now, if I ask you a question and by chance if you give me a wrong answer and I say, आपको इतना भी नहीं पता, इतना भी नहीं आपको idea है. I mean, I'm trying to just help you see that you don't know, but that's very insulting way of telling somebody. So some of the behaviors can actually be overlooked rather than reacting. A lot of time your staff might do something that is non-acceptable, you have to assert, but something that is acceptable, that can be overlooked, and we can go ahead with the conversation. Any other example? But thank you, Dr. Neha. I think you gave a very apt answer. Thank you. Any other example? Dr. Saloni, Dr. Vidya, Dr. Sudagar?
Hello.
Yes.
Can you hear me?
Yes, I can hear you. Yes, go ahead.
Yes, ma'am. Something similar to this. What happens is when patient and attender they look into a lot of this Google thing and they get into so much into the surgery. Like they sometimes even ask what you do for this, some septoplasty, anything. They just want more details. Sometimes I just stop them there and I have to interrupt and say, that's my duty. Somehow it's my duty. I'll take care of it from my side. It's by saying, revealing that or saying that, it doesn't going to change, or I don't know, it's gonna make them more apprehensive only. But in spite of that, some people, some patient and mainly the relatives keep asking that. Absolutely. Sometimes I say them stop, interrupt them and say something like it's my job type. So maybe I could avoid that, but sometimes it gets, I stop there. That's one thing I felt I should stop.
Absolutely. So I think there's a clarity now that sometimes we use the words that are not appropriate, and we need to be more mindful, especially with the team with whom you are working. They are your support system. They are your asset. They are the one who get you, work. So if you have good rapport with them, they will facilitate your work. So when you insult them or when you hurt them or when you show them or belittle them by using these ways, they feel bad and they become less cooperative, or they become inhibited to talk to you. Similarly with patients, if this is the way we sometimes snub them or we shout at them, so they may not come back to us. We may not realize that it is because of our behavior that the patient hasn't come back, but a lot of time that happens. So I wanted to show you a video. Let me see, because the whole thing got disrupted because of the electricity failure. If I can catch hold of that video, I want to show you that video. Give me 1 second to locate that video. I've lost the whole slide. This thing. Give me a second. Okay. So allow me to share the screen. I'm going to show you a video and I'll be asking you a couple of questions related with it. So
I have only one complaint with what you said.
Tell me.
You know that Saraswati is also the goddess of dictionaries.
No, when I write, actually, I realized one thing. In India, people do speak English, but out of 100 people, 10 to 20%, whatever you do, they don't understand English. I come across many people like that. About 10-20% people are extremely good in English with their vocabulary, like you, Ram Goa, and many more people, who are very, very good. I mean, it requires, if I have to read yours, I require a dictionary because it's so good. Beautiful sentences, such a good words. Then I said, okay, Shashi has done fantastic, but that is his strength. But 50-60% of the people in India, they're like us. We speak, colloquial language. We understand English. We'll be able to read. I'm fine translating English into Kannada, Kannada to English. I'm fine, you're fine here, everything is okay. Okay, that kind of think in Kannada, write in English. Most of us are like that. That's the reason I realized, I used to think people, when I write my book, people buy it because of Narayan Murthy's wife, or is it they buy because, let's see what she has written? No, people buy because they can relate to me. Their English is like my English, but I have experience. So that's what.
What do you say about communication and language skills? What do you say? I'm sure you must have heard him a lot of times. What do you say? Have you heard him earlier? Have you heard Shashi Tharoor earlier? Am I audible?
Yes, Dr. Hindu.
Dr. Sakshi, am I audible? Oh, am I audible now?
It's not clear, ma'am.
Yes.
The voice is breaking a lot.
Give me a second. So am I audible now? Dr. Sakshi, am I audible?
Yes.
Okay. So if I may ask you about the video that we saw just now, what do you think about Shashi Tharoor's communication skills? Or what idea you have about his communication skills? Anybody? Have you heard him earlier? Dr. Neha, have you heard him earlier?
Too many jargons. Don't understand what he meant by a lot of words he uses.
I think that's what we know about.
They're good English, good to hear, but at the end of the day, we don't understand what he's saying.
Absolutely, absolutely. So, what is the idea about Dr. Sudha Murthy's communication? So, Dr. Neha, what do you think about Sudha Murthy's communication?
Ma'am, she's more relatable. She speaks more the way that we speak. Even though Shashi Tharoor's language is immaculate and very posh, but we cannot relate with it.
Absolutely. So that means when we are connecting with the patient, when we are talking to the patient, rather than just using heavy jargons, can we speak the language that the patient can understand? A lot of time we talk to the patient, we are trying to explain to the patient, but patient actually does not understand anything. And then we think we have explained it very well, but the patient has not actually understood. Let's do a small activity. And I want to ask you, how many of you think that you are good communicators? Raise your hand and say. How many of you think that you are a good communicator? Dr. Sakshi,
can you please repeat? I couldn't hear the question.
Okay. My question was, how many of you think that you are a good communicator?
Yes, I think I am, because I usually prefer to speak to the patient in their language. Many of the patients here comes from Gujarat also. I'm basically from Gujarati. So when I talk to them in Gujarati, they become very happy, they become more confident, and they trust me. So,
wonderful. Wonderful. So we are going to do a small activity. So incidentally, only 5-6 of you are visible to me. with your camera on. So I will have to engage only those who are visible here. I'm going to put you in the waiting room, and then I'll be taking you back one by one. Is that okay with all of you? Is that okay? So I'm going to put Dr. Saloni in the waiting room. Then also Dr. Neha, Dr. Vidya, and Dr. Rahul. Okay. And then one more person. Who was that? Dr. Dr. Sudhagar. So I'm going to put you in the, no, but then I will require Dr. Sudhagar here. Dr. Sudhagar, is your video on? Is your camera on? Okay, thank you. So Dr. Sudhagar, I'm going to show you a slide. I'm going to show you a slide and I want you to read that information, but give me a second to get that slide because I need to now reload that slide. 1 second I need. Yeah. Okay, so can you see this slide? Is this slide visible to you?
Yes, ma'am. I
Yeah.
can.
So you can read this slide. You can read this slide and tell me when you are ready. And all others whose cameras are not on, I'm sure you are also able to see. So read this slide to yourself.
Should I read it out or just?
No, you can read it to yourself. You just
Okay.
read it to yourself and
Okay.
just tell me when you are ready.
Okay.
Are you ready?
Yes, ma'am.
Okay, thank you. So I'm going to get one person who from the waiting room, and I would ask you to, whatever you have understood from the message that I showed you, you need to share that with the next person. So I'm getting Dr. Neha. So whatever you have understood, you need to explain to Dr. Neha. Let me just brief her and then you tell in your words what you understand. Okay. So Dr. Neha, Dr. Sudhagar has a set of information. Please listen to him carefully. Dr. Sudhagar, please go ahead.
Hello, Dr. Neha. Hello, can you hear me?
Hanji, sir.
Yeah. So this is a patient who is a 65-year-old male, Mr. Ram, and he is suffering from pulmonary coughs, and he is in the ICU for the past 5 days, and his family has already spent around 5 lakhs, and they are concerned about his recovery, and the family is concerned about the recovery, and they wanted to meet the doctor. His son is the only breadwinner of the family, and they want to meet the doctor in person. You got it? Ma'am, this is what I...
Thank you. Thank you, Dr. Sudhagar. Thank you so much. I think you explained very well. So, Dr. Neha, whatever you have understood, now you need to explain this to the next person whom I'm going to bring from the waiting room. Give me a second to, add the person. And I'm taking in Dr. Vidya. So whatever you have understood, you now need to explain in your words to Dr. Vidya. Let me get her in. So Dr. Vidya, can I request you to have your camera on? Thank you. Yeah. So Dr. Vidya, Dr. Neha has a set of information she's going to share with you. Please listen to her carefully. Yes, Dr. Neha, please go ahead. Yeah, please go ahead.
Hello, sir. Can you hear me?
Yeah, hi. Hi.
Hi. Hello, Vidya. Hi.
Yeah, hi.
So this is regarding a patient. He's a 65-year-old male.
Okay.
And he has pulmonary cough.
Okay.
And he's being treated for it in the ICU for past 5 days.
Okay.
And the family has already spent around 5 lakh rupees on the treatment.
Okay.
And so the son of the patient wants to talk to the treating doctor regarding the treatment and regarding the patient. The doctor wants to, the son of the patient wants to talk to the treating doctor.
Okay.
Thank you, Dr. Neha. Thank you. So, Dr. Vidya, I'm going to add the next person, and I would ask you to explain in your words whatever you have understood. Is that okay?
Okay, okay.
So I'm bringing in Dr. Rahul, and you need to now explain whatever you have understood to Dr. Rahul. So let him come in, and then I'll ask him to have his camera on. So Dr. Rahul, if you can have your camera on. Thank you. So Dr. Rahul, Dr. Vidya has a set of information and she's going to share with you. Please listen to her carefully. Yes, Dr. Vidya, please go ahead.
Yeah. Hello, sir. Can you hear me, sir?
I think, Dr. Rahul, you need to unmute your device so that you can reply verbally.
Oh, sorry. Hi.
Hi, sir. Hi. Okay. So I will be telling you a set of information, sir. Okay. So this is regarding one patient. He's 60-year-old man who is been suffering from pulmonary coughs. He's been diagnosed with it and he's been taking treatment as such. But since past 5 days, he's been admitted in the hospital, ICU. Okay. And the parents, the attenders have already spent a lot of money, more than about 5 lakhs on him. So the attenders want to communicate with you, the treating surgeon. They want to speak to the treating surgeon regarding what would be the further plan of management and the cost, everything.
But for which surgery?
Not surgery. He's been diagnosed with pulmonary coughs, and so he is in the ICU.
Okay. Yeah.
Okay. So how many more days of stay he needs, and what would be the further plan of management? Regarding these details, the attenders want to communicate further with you.
Yes, definitely. No problem.
Thank you. So Dr. Rahul, I'm admitting Dr. Saloni, and whatever you have understood, you now need to explain in your words to Dr. Saloni. So Dr. Saloni, Dr. Rahul has a set of information. He's going to share with you. Please listen to him here. Yes, Dr. Rahul, please go ahead. Yeah.
Hello.
Hello. Hi, Dr. Rahul. Am I audible?
Yes, doctor.
Am I
You're
audible?
audible. Yes.
Okay.
Yes. Hello, Dr. Saloni.
Hello.
Hello, ma'am.
Yes, Dr. Rahul.
Hello.
Tell me, please.
Actually, there is one patient who is a case of pulmonary cough. He's been diagnosed of pulmonary cough and he's admitted in ICU.
Okay.
So the relatives of the patient want to know the status of the patient, the treatment plan, and further treatment plan, and what is the outcome of the patient. So they just want to talk with the in-charge doctor or in-charge surgeon to discuss regarding all the details of the patient and treatment management of the patient.
Okay. The patient is admitted for pulmonary coughs.
Pulmonary coughs. He's been diagnosed as a case of pulmonary coughs, and he's undergoing a treatment for the same. And he's been now admitted in ICU because the condition of patient is not so good. So the relatives of the patient want to discuss regarding plan of management of the patient and they want to discuss with the in-charge doctor. So
okay, sure. Okay, sure. We can connect with the patient and the patient's relative whenever they want.
Okay.
We can discuss about all the condition of the patient, what is going on, what the treatments are going on, and what is our plan for the further treatment, further investigations, and what all will be the prognosis and everything.
Okay. So, Dr. Saloni, whatever you have understood from what you have received from Dr. Rahul, can you explain in your words? Can you restate?
Should I repeat whatever he said?
Yeah, kind of. Can you repeat?
Okay. So, Dr. Rahul is saying there is a patient who has been admitted in the ICU with the diagnosis of the pulmonary coughs, and the relatives wants to talk to the in-charge doctor and discuss about the recent treatment and the further plan of the in the patient and the prognosis of the condition.
Thank you. So, Dr. Sudhagar, was it this that you had communicated to the next person?
Not exactly, ma'am. There were missing informations.
So, what was it?
Can I repeat it, ma'am? It is this is about the patient, Mr. Ram, 65-year-old male, and he was suffering from pulmonary coughs, and recently got admitted in ICU for 5 days, and the family spent around 5 lakh rupees, and they're concerned, and the son is the only breadwinner of the family, and they want to meet the doctor. This is what I
must see what happened to
this
the information.
This is the detailed information.
Exactly.
And the ideal one.
We all think that we communicate very effectively. But very honestly, when we receive the information, we have multiple filters in us. And when we are communicating, those filters become hurdle and they may cause omission or commissioning of the information, and we might distort the message. So a lot of time when we are communicating with the patient, what we say and what patient understand could be very, very different. So therefore, it's very important to actually check what has patient really understood. So can you tell me, how do you confirm whether the patient has, whatever he has shared, has the patient really understood?
Ask them to repeat.
Making them,
ask them to repeat.
Exactly. Ask them to repeat.
Repeat in between.
So that at the
ask them to ask questions if they have any, so that we can understand has he understood everything.
Wonderful. So I think both the points are very well taken. One, you said that you ask the patient to repeat what we called as teach back. So that's a technique that we called teach back. So we get to know whether the patient has really understood exactly what we mean to say, because patient's perception, patient's attention, patient's past experience will interfere with the patient's understanding. And what you said will be very different from what the patient will understand. Another point, Dr. Saloni, you said about asking, do you have any questions? So how do you normally ask this to the patient?
I usually ask patient, Yeah. Like if I conclude, okay, so we are planning for this surgery. Then at the end, I ask them if you have any query regarding the surgery or the investigation on what is the procedure, what is the post-operative care, you can ask right now only, because I'll guide you everything so that you will be prepared, and you can tell your family members also about the same condition. You can explain them well so that you all can get ready for the surgery. And if you have any query and your family members also are having any query, you can get them also next time with all the questions. You can search on Google about the surgery also. I usually tell patient and write it down in a separate paper about the name of the surgery. I ask them, you can Google it, you can see the videos, and after that also you have query, then you can come with your family member, and I am happy to ask all the give all the answers. So this is what usually these days patients prefer.
Excellent, excellent. So if I may add just one point to what you said, when you ask, do you have any questions? So we are actually asking a leading question. Do you have any question? Is a leading question, and the answer most likely could be yes or no. Instead, if I ask, what questions do you have regarding your treatment? So if you can bring this change in your strategy, because the idea is that you want to open a dialogue with the patient. The more dialogue you will have, more you will be able to give information as per your patient's requirement. More dialogue you will have with the patient, you will get an idea about what is patient's understanding of his or her illness. Is it urgent? Does this need immediate intervention? Or whatever doubts or fears the patient has or myths the patient has about the illness, you will get to know when you will ask questions like, what questions do you have regarding your treatment? Or when you ask, what concerns do you have regarding the outcome? Or when you ask, what challenges do you see in getting your surgery done at the earliest? So if you can just bring in this change in your questioning style, instead of asking, do you have any questions? Let me know if you have any questions. Instead of that, if you can bring in this way of asking question, what questions do you have? What concerns do you have? What challenges do you see? You will get a deeper understanding into patient's mind. And this will give you an opportunity to open a dialogue where you will be able to see patients' concerns. So there is an acronym called IICEEE. If you really want to win your patient, and if you can use this acronym always when you're interacting with your patient. I think the way Dr. Saloni explained, that's a wonderful way to actually send the patient when you're sending the patient. But during conversation, if you can remember this acronym, and I'll give you the explanation about it, you will actually see that the patient goes satisfied and much knowledgeable and much ready for the treatment. And what is that IICEEE? The first I is patient's idea about the illness. So try to ask, what do you think your illness is? What do you think? What has caused this? So you will get an idea what is patient's understanding of the illness. So first I is idea. Second I is, what is the impact of illness on the patient? Second I is the impact of illness. So when you will ask the question, how is this disease affecting you? How is, for example, a patient has come for cataract surgery and the patient is still contemplating, should I get this surgery done? Can I wait for 2-3 weeks or 2-3 months? And you ask, how is this disease impacting your lifestyle? And the patient says, I have difficulty at night. I'm not able to walk around. I find difficulty going to the dark places and also independently going to the toilet. So now you know that these are the challenges the patient is facing, which you can use later on when you are explaining why you need to get this surgery done now. So if you ask about the impact, you will get an understanding how is this patient suffering because of this illness. Now coming to C, IIC. C is concerns. Patient may have concerns about the disease. Patient may have concerns about outcome. Patients may have concerns about how many times they have to come for follow-up. Patients may have concern about for how long do I have to take medicine. Patient may have concern how many days leave I need to take. Patient may have questions about what is going to be the financial implication. Or for example, any long-term medicine or long-term intervention. For example, if you are planning a bariatric surgery for your patient will have concern. Will I be able to eat this much? Will I be able to, will there be any dietary changes? And what will be the financial outcome? So when you ask this question about concerns, you are having a dialogue. You are getting a peep into the patient's mind. See, when you ask these questions, patients feel, okay, this doctor is really concerned about my concerns. And then when you get to know their concerns, now you know these are the concerns. I have to make sure before the patient goes, I give satisfactory explanation or understanding and satisfy these concerns. So naturally, if you have answered patient's all concerns, the patient is all yours. Patient is not going to go anywhere. Now coming to the triple E, double IC we have discussed, triple E, the first E is patient's expectations. Very important. What do you expect after the treatment? What do you think will happen after the treatment? So a lot of patients will have unrealistic expectations. And it's very important to know that this patient has unrealistic expectation. I need to address these expectations. I need to fine tune these expectations. So when patients get some cosmetic surgery done, so they suddenly feel, I am going to look like a heroine. I'm going to look like whose name should I give? Who has got maybe Anushka or maybe Shilpa Shetty. So people might think that I look like this. So that means if this patient has this high expectation, and I know this surgery is not going to make her Shilpa Shetty. Maybe it will make her look better, but not like Shilpa Shetty. So I know I need to explain to this patient clearly that this is what is going to be the outcome, so that this patient tomorrow does not catch hold of my collar and says that you promised me this and you delivered me something different. So understanding patient's expectations. If it is unrealistic, usually we get angry. Usually we are upset. Patient क्या समझते हैं अपने आप को? हमारे हाथ में क्या कोई छड़ी है कि हम ऐसे घुमाएंगे और इनका नाक एकदम उसकी तोते की तरह हो जाएगा, हाँ, या इनकी गर्दन एकदम सुराही जैसी हो जाएगी. So rather than getting annoyed, I would rather interact and explain and also make their expectation realistic. The second E is emotions. It's very important to understand the emotional milieu of your patient. Patients who are anxious, patients who are depressed, patients who are nervous, they are differently going to react to the disease, treatment, and outcome. So if I know the emotional makeup of my patient, I know that I need to manage these things besides the treatment. Patients who are sad, patients who are apprehensive, who are anxious, who are more prone to becoming upset, irritable, aggressive. So that will give you an idea, okay, this is the patient's emotional makeup. I have to handle this. So at the end, after the treatment, how would you really send the patients, satisfied if you are able to look after this aspect of the treatment? And the third E is patient's experience. When patients have any good or bad experience about the disease or the treatment or an outcome with you or with different doctor, that's going to affect your interaction with your patient. So during your conversation, rather than explaining voluntarily what you want to explain, first check this. Double I, C, triple E. And if you have peeped into this, now you know in my explanation what all I need to give. So then your communication will actually become very need-based, very, very relevant, and the patient will actually feel, okay, all my questions and concerns have been answered and I'm going satisfied. Now imagine if I've asked about what are your concerns, so maybe it was financial concern, and if I've been able to ask, do you have any financial concerns about your treatment? And the patient says, yes, I want to discuss about it. And if you discuss at length, whatever options you have, you talk about that. All the answers, questions are answered, patients are likely to come back to you. Your interaction with the patient. Okay, how much time do we have? It's already 2:45, because I don't want to take your time beyond a point. Only if you're with me, you're liking it, you want to listen more, I can go on and on and on. So let me know what's your how much time do you want to spend? Sakshi, do you have any idea for how long you want me to continue?
Yes, Dr. Indu. Yeah, I think we should just start winding up, and we already have an agenda in place for the next workshop. So maybe we can keep those things.
So I can only say one thing. I think if you want me to wind up here, we have discussed majorly about the language part. There is a lot about the paralanguage, a lot about the body language, which we'll be covering in the further session. Everything will be covered in a very practical manner. No theory. I have not shown you any presentation. I have not shown you any theory. I'm trying to just give you the practical tips of how do you go about, having a dialogue with your patient. So building rapport, winning trust will automatically simultaneously happen if your quality of interaction is in this manner. A lot would depend on your communication style. I had sent a questionnaire on communication style. Let me just check how many of you have actually answered to that communication style questionnaire. Give me 1 second to see the answers. Only 7 of you have done this. So I think it will be a good idea if all of you take this questionnaire and we have a discussion about it in the next session. And then we will take it further from there. Is it okay? Is it okay? Any questions about what we have discussed till now? Or I shouldn't be asking this. I should be asking, what questions do you have about the discussion we have had just now? So any questions would be no, there's no question. What questions do you have about the discussion we have had just now? No questions? So I'm glad at least some of you are nodding no. That's giving me a feedback. Okay, you are with me and you are listening to my question and you are answering. So if there are no questions, I think we can close it here. And then whenever we plan the next session, we'll continue from that. Dr. Sakshi, do you want me to close it here or you want to make any?
Yes, I would just like to thank all the doctors for joining us, and we look forward to greater participation in the next upcoming sessions. And we hope you all enjoyed the session.
Thank you, Supriya. I think she has messaged in the group that it was a really helpful session. I really hope, but I'm trying to make it as practical as possible and to the point. No theory, no Western, concepts. What we can do within our own healthcare system. I think that's what I'm trying to emphasize. I've done around 2,000 programs across the country, so I relate very well with all of you, and I know your challenges. So just you need to be with me, participate, enjoy the session, ask your questions, bring in real life situations, and we can discuss about them. Thank you so much. Thank you.
Thank you so much, Dr. Indu. It was great having you.
Thank you all of you. Bye-bye. Take care. God bless you.
Thank you, ma'am.
Thank you so much.
Thank you, ma'am.
Thank you.